in 2020. But we are so much more than just the safe consumption site. We also have a family program, youth programs, residential services, and that kind of thing. Just to give you guys a bit of an idea of what we do here at PHR, I'm just going to share my screen. All right. So this is a presentation on de-escalation, so working with people who are escalated due to substance use. So before we talk about escalation due to substance use, we should probably talk about the typical substances that are used. Alcohol is one of the most common escalated substances. Some of the behaviors include impulsive behavior, impaired attention, impaired concentration and judgment, drowsiness, aggressive or violent behavior, slowed reaction time, slurred speech, double or blurred vision, nausea, vomiting, impaired memory, or loss of memory. Amphetamines are considered uppers, so things like methamphetamine and that kind of thing. So that is feelings of sudden euphoria, things that are called a flash or a rush, having less inhibition, similar to being drunk, feeling as though your thinking is extremely clear, feeling more in control and self-confident, being more social, having increased energy, appetite decreases and weight loss, heart problems such as fast heart rate, irregular heartbeat, increased blood pressure and heart attack, memory loss, problems thinking clearly, and stroke, mood and emotional problems such as aggressive or violent behavior, depression and suicide, hallucinations, restlessness and tremors, skin sores, sleep problems, and tooth decay, which is called meth mouth. Another one is opioids. These are one of the ones that we see the most here in Saskatchewan. So they're sometimes called narcotics, and they're a class of drugs that are chemical or natural or synthetic that interact with nerve cells and have the potential to reduce pain. Healthcare providers typically prescribe opioids to manage pain. However, opioids are very addictive because they not only dull pain, but they give a sense of euphoria. This and combined with tolerance build, which means you need to increase your dose to produce the same effect, can lead to opioid use disorder. Some of the effects include drowsiness, sedation, dizziness, nausea, vomiting, constipation, physical dependence, which results in withdrawal symptoms, which is someone who's dope sick, an increased sensitivity to pain, delayed gastric emptying, muscle rigidity, immune system and hormonal dysfunctions, chronic constipation, sleep disordered breathing, increased risk of bone fracture, and increased risk of overdose. Some more common drugs are psychedelics, which is things like LSD, which is acid, magic mushrooms, and that kind of thing. So some of the effects of those are hallucinations of sight, sound, taste, and touch, a blurring of the senses, such as colors being heard or sounds being felt. You feel very detached from the body, distortions of time, direction, and distance, relaxation, accelerated heart rate, dilated pupils, nausea, loss of appetite, and some people have bad trips, which is a very negative time when you're on psychedelics where you can't really tell the difference between reality and not reality. Another very commonly used drug is cannabis. Cannabis can make people feel more happy or relaxed. Cannabis can cause altered time perception and impaired thinking, memory, and body movement. It can also make people feel more irritable or restless. But that being said, cannabis can also cause psychosis. So all of these drugs can cause psychosis. Psychosis refers to a collection of symptoms that affect the mind where there has been some loss of contact with reality. During an episode of psychosis, a person's thoughts and perceptions are disrupted and they may have difficulty recognizing what's real and what isn't real. People in psychosis typically experience delusions and hallucinations. So seeing or hearing things that others don't, such as hearing voices that tell them to do something or criticize them. any and all substances can cause psychosis, including common medications. Lots of people can have cannabis-induced psychosis when they're a regular cannabis user. Some of the signs and symptoms of psychosis are delusions, which are beliefs that are clearly implausible and persist even with clear evidence that it is obvious and convincing to others. Hallucinations, so sensory experiences that don't match reality, such as seeing, hearing, smelling, or feeling something that's not actually occurring. A person might hear voices that could be complimentary, neutral, or damning. Disorganized thinking, speech that is so disorganized that it impairs basic communication. A person might rapidly switch from one topic to another or say things that are incoherent to others. And disorganized or abnormal motor behavior, so decreased reactivity, slowing down, unpredictable agitation, or bizarre and rigid posturing. Now we have a fun little game. If you guys can go to the link below here. We're just going to talk about assumptions and discrimination and stigma surrounding substance use. Everybody is guilty of it. Sometimes we don't even know. So there will be a link here. I'll pull it up in a few minutes. If you could please provide an anonymous answer to that, I'll give us maybe 3 minutes, if that works for everybody. Has everyone had enough time to see the link? All right. So when we're talking about substance use, one of the things that we have to talk most about is stigma. So as professionals, it is our job to check our bias at the door, and it is not the job of people who access our services to make our workday easier. It's our job to make their lives easier. There's lots of discrimination and stigma surrounding drug use and addiction. A lot of the words that you guys have used are fantastic. There's not very many stigma or bad words there. Lots of these things are true. Trauma and substance use go hand in hand together. Poverty and classism are very common in substance use. Foster care, that happens as well. Family sadness, fear, heartbreak, isolation. These are all very good words. And all very good things to think and not very stigmatizing or discriminating. So I appreciate you guys doing that little activity with me. So what you guys are all here to do de-escalation training. So de-escalation requires patience and a very calm presence and strategic communication. So the goal is to reduce tension, prevent harm, and support an individual in regaining control over their emotions and their behavior. We have the term EAR, which is engagement, assessment, and resolution. Typically we assess first, but AER is less easy to remember. So remembering EAR is just as good. Engagement, assessment, and resolution. So engagement, you are building trust and validating the person and their situation, building kind of a relationship if you can. Assessment is you're gathering necessary information to make the safest resolution. And finding a resolution is returning to the pre-crisis state of the situation. So your first step, you will be assessing the situation. You want to check for immediate safety risks. You have to be very observant. So observe the person's body language. Are they pacing? Are they clenching fists? Are they making erratic movements or showing signs of paranoia? You want to look for potential weapons or dangerous objects. If they are armed or in a dangerous setting, do not engage alone and call for help. Assess the environment. Are there other people around? Are there exit routes if available if needed? Some people have taken PART training, professional assault response training, through SSW, Saskatchewan Association of Safer Workplaces and Health. That's when your PART training would come in and you're looking for exits. You're not going to want to back yourself into a corner that will make you less safe. Just assessing the situation and your safety is number one. You want to determine the level of distress the individual is in. If they're mildly agitated, the person is upset and loud, but they're able to communicate with you still. If someone is moderately agitated, so the person is irrational, pacing, making threats, but not yet physically aggressive, and severe agitation, which is the person is actively aggressive, screaming, or unable to process communication. So the second step is to regulate yourself. You need to control your own reactions. Sometimes it can be very difficult when you're scared or in a difficult situation like that, but as a professional, it's very important to regulate yourself and be calm and centered. Take deep breaths when needed before engaging. If you appear nervous, people might mirror that. You want to avoid aggressive body language. You want to keep your hands visible. Don't cross your arms across your chest or puff up and be bigger. You want to maintain neutral posture. Slow down and speak and move at a slower pace to signal safety and control, and be very mindful of your tone and language. So use a low and steady voice. Don't be loud or talking too fast. Loud or rapid speech can feel a bit threatening. Use short and simple sentences. Overwhelmed individuals may struggle to process complex information. So step 3 is establishing a connection, which is can be really make or break in de-escalating someone who's escalated, especially due to substance use. So introduce yourself and your intentions. That's very important. Saying something like, "Hey, my name is Aly. I just want to check in and make sure you're okay," while giving people space. So don't get too up in someone's face. You want to give someone space. If they're escalated and flailing about, you never want to get too close to somebody. Avoid authoritative phrases like calm down or you need to stop, as they can escalate tension. Nobody likes being told what to do, especially an adult. If you know their name, using that could be really fantastic. I hear you, name. It seems like you're going through something tough. Using name builds that person to person connection, and acknowledging someone's feelings without judgment. Saying something like, I can see you're really frustrated right now. That makes sense. It sounds like you're feeling unsafe. I want to help. Giving someone personal space again is very important. Staying 2 arms lengths away unless they indicate that they want closer support. And avoid direct eye contact if they seem paranoid or aggressive. Nobody likes having eyes staring on them very intently when they're having a moment. So just giving people that respect. So step 4 is using de-escalation techniques, adjusting to their emotional state. If someone is loud and screaming, don't match their volume. Speak a bit softer but clear to encourage them to mirror you. If they're paranoid, don't contradict their fears. Instead, provide gentle reassurance. So saying, I hear you, I understand, that must be scary. Are you okay? I'm here to help. Phrases like that. You also want to avoid power struggles. So if someone is saying something irrational, like everyone is out to get me, don't argue and instead validate their emotions. Saying something like, that sounds really scary. I want to help you feel safe. Instead of saying, that's not true. No one is after you. Especially working with people who are escalated due to drug use and people who are using drugs. Sometimes there really can be people out to get them, and you don't want to invalidate them by saying that's not true. Being street involved or being someone who uses drugs, there are the risks of someone being out there to get you. So you want to help them feel safe and not invalidate their experiences. Offering choices to regain their sense of control is really important. Just giving people the autonomy and the decisions over their own body, their own choices, and even just little things like, would you like to sit down here or would you like to sit over there? Do you want water? Do you want a snack? Would you like to smudge? Can I call someone for you or do you just want to talk? Things like that are very important when de-escalating someone. So this should say step 5, not step 6, is to provide support or an exit plan. So you're talking to someone, you're trying to calm someone down, asking them what they need is so important. Instead of assuming what you think they need, asking them what they need is something very important. Something like, what would help you feel better right now? Do you need a quiet space or would you like to keep talking? Offering water is so important. Offering smudge if you're available, or if you have it available is also very important. Sometimes even offering to go outside or go for a walk, just giving someone that space and that autonomy to choose is very important. Offering resources if they're appropriate. If someone is escalated and they need medical help, offer a ride or to call an ambulance if necessary. I know some folks don't like getting rides in ambulances. That is completely up to them. That is their choice, but you can offer that and extend that to them. If they need a safe place, direct them to harm reduction or shelter services. And if they just need space, allow them to disengage without pressure. Giving someone the space to feel out their emotions or their escalation is really important as well. And also knowing when to take a step back. So if someone is escalating despite your efforts, they may need more time or a professional intervention. And if they start yelling and becoming physically aggressive or unresponsive, you need to ensure your own safety and call for backup supports if needed. So if you've done all these steps and people are still really escalated and you have to call someone else, that's okay. If you can't de-escalate someone by yourself, that is completely okay. If you had to call the police or if you had to call an ambulance, things happen and that's okay. So if they have de-escalated and they've calmed down, ask them, how are you feeling? Are you okay? If the situation occurred at a workplace or a community setting, check in with other staff and debrief the situation and really reflect on what worked and what didn't. Things like, did they need more space? Were there triggers in the environment that contributed to the escalation? Every situation is different, just as every individual is different. And some things that might work for some people might trigger and upset other people. It will never go perfectly well when you're de-escalating someone due to substance use. Um, things will never go as smooth and as perfect as possible. And just a reminder to be gentle with yourself, be gentle with the other staff that you work with, and be gentle with the individual who has escalated due to substance use. When we're seeing people who are escalated due to substance use, we're typically seeing people on some of the worst days of their lives. So giving them a little bit of grace and understanding that they might not be mad at you, they might be mad at a situation, they might be mad at the psychosis that they're in, telling them that someone is out to get them. They might be triggered and reminded of something that happened to them when they were younger or something bad that happened to them and it triggered that emotional state. So just being understanding of the individuals who are escalated and also showing yourself kindness and understanding if you had to call some backup, if things didn't go well, if you re-triggered someone by accident, things like that. And having a great workplace or people to debrief with. There's always people like counseling, that kind of things, just someone to debrief on the situation with to make sure that you're getting the help that you need as well. Because sometimes it can be traumatic seeing someone go through that state of escalation. Now is for the question part of this presentation.